Muscles determine the way that we look and how we function. But the most important muscle, the heart, is the one that's often most neglected. My special guest, Dr. David Carmouche, is a specialist in cardiovascular medicine, works at the Baton Rouge Clinic, is going to share with us his knowledge how to look for problems or risks that affect our cardiovascular health. Dr. Carmouche, welcome to Living Fit. And let's start off with a word that we call hypertension or blood pressure. Why is it so dangerous, and how does it affect cardiovascular health?
Sure, Bill. Well, blood pressure is a condition that really has no symptoms for most patients, and unless we actually apply a blood pressure cuff and check the blood pressure, we have no idea whether it's normal or not. We define normal blood pressure in the United States as 120/80 or less, and it's elevated when it gets much above that. It has a tremendous effect on our brain function by increasing our risk for stroke. It places a tremendous amount of strain on our heart and causes our heart to enlarge, and it can affect the kidneys and is one of the leading causes of chronic kidney disease in the United States.
So it's really, really important that we work with our doctors and keep an eye on our blood pressure.
Absolutely.
The next key point that we always hear about is cholesterol. But what most people don't realize, there's different types of cholesterol. And can you please explain to us what they are and how they affect our cardiovascular health?
Sure. I just want to make sure the audience understands that when studies have been done to look at the risk factors for heart disease specifically, elevated cholesterol or abnormalities in cholesterol always seems to be the most important factor from a heart disease perspective. And you mentioned that there are relatively good forms of cholesterol and some that aren't so good. And the LDL cholesterol is referred to by doctors in the United States as the bad cholesterol. It's the cholesterol that most likely causes plaque buildup in the arteries. HDL, or so-called good cholesterol, really represents the cholesterol that is being taken out of our arteries and brought back to the liver to be recycled. So knowing the ratio of the bad cholesterol to the good cholesterol is very important to clinicians in helping patients determine the right course of action to lower their numbers if they need to be lowered.
Triglycerides are often put in together with cholesterol. What's so important about triglycerides and our waist measurements?
Sure. So triglycerides have only recently become known to be a risk factor for cardiovascular disease. And it's important because triglycerides really come predominantly from our diet and reflect an inability of our bodies to metabolize sugars. And there is a relationship between waist circumference and abdominal fat and elevated triglycerides. So in my practice, high triglycerides are really a marker of not only abdominal obesity, but patients who may be at risk for both diabetes and heart disease.
Now, something that's fairly new as far as we're concerned out in the public is chronic inflammation. We got 30 seconds left, Dr. Carmouche. Why should we keep an eye on that? And why is it important that we be aware of our numbers?
Sure. So there is a blood test that physicians are increasingly ordering in the United States called C-reactive protein, which is an inflammatory marker. A lot of research has now shown that inflammation in our body, whether related to illnesses like arthritis or other forms of inflammation, have a dramatic impact on the rate at which plaque builds up and the rate at which that plaque can cause heart attacks.
Dr. Carmouche, thank you so much for being with us. I look forward to having you back. And this is going to be a continuation of this series of cardiovascular health with our special guest, Dr. David Carmouche.